Thank you all for joining us. Today, more than ever, we are seeing sweeping changes that have been made to the guidance from our state leadership. So we're going to ask you to pay really close attention today. At the same time, we can all take the most proactive steps to protect ourselves and our families. So four keys here. Vaccinate when you are eligible. Booster when you're eligible. These prevent less severe reaction to COVID. Mask when you are in public places. Test when you feel ill. And then stay home. So four keys. These are the simple ones today. And with that, I'm going to turn it over to Matt. Thanks, Matt. When you are
Thanks, Shelley. I don't have a lot before I turn this
Booster
over to the
when
experts here with Paul and Dan. I'm glad they have both of these individuals on hand to discuss the recent changes in guidance, what Genesee County is doing, and understanding what is happening not only in our public health community, but in our hospital. Just really quick, we did have a test kit distribution this last weekend. It went very smooth. We had over 1,000 cars come through in about 2 hours. We put it out at our fire training center to allow for more cars to get in and out as safely as possible. But we thought it went very well. I was very impressed with the community members that came out to help support. And it was nice to see all the smiling faces as we were giving these test kits out. We plan on more of these in the future. I know these are highly sought after in our community, and we are ordering additional ones here in Genesee County. But as you can imagine, we have challenges in ordering them just like everyone else. But we are putting through large bulk orders, and we do anticipate future distributions from the state. And as they come in, we will continue to do not only these drive-through clinics, but we're going to also do, we're going to be placing these throughout our community at our town halls and various locations in our towns, so that people have multiple options to where to go seek these out. And we will post these and do press releases so people know when they are available. So this is part of our commitment to continually trying to get these test kits out there on the street, along with the masking. So with that, I'm going to turn this over to Paul, who has a litany and list of updates for us, and then Dan, and then we welcome any questions that you may have for us.
All right. Good morning, Matt. Thank you for that. And thank you, Shelley. It's nice to be with everyone again to go over these COVID updates. And as Matt just mentioned, there are a lot of things that have changed in the last week. Things have evolved quickly over from when we talked right before the holidays back in early December. So again, we try to do these a minimum of once a month to share information as best we can, to speak directly to our folks in Genesee and Orleans County and let them know what's going on to the best of our ability. And it is challenging as things are changing so rapidly. You know, we're working to digest this information, make sense of it, and then try to articulate it clearly back out. So we're going to spend a little bit of time walking through some of those changes today. Again, just trying to make sure our folks have as best of understanding as they can to what some of these changes are. And, you know, again, we'll continue to do that moving forward. I do have some data that I'll share, kind of updates on our numbers locally, and some information around testing and some other key points we want to share. And then obviously we're very happy to try to answer any questions that may be out there that we can articulate. And if we don't have the answers, we'll get back to you. As always, I do have a couple of my folks in the background that are on this call that will be adding information into the chat box. So as we go along, they'll be putting in potential links and different information. And if you have questions, you can feel free to ask them in the chat, and we'll capture those, and they may answer them as we go along. So it's nice having those folks helping us out. So thank you for doing that. In addition, you know, we're just gonna, again, open it up for questions after I talk and after Dan shares a few things on the hospital side. And, you know, we'll again, try to answer what we can. But as I start all of these calls, I do want to send a shout out and thank you to my staff, both Genesee and Orleans County Health Department. You know, they continue to work very steadfast and continue to put in a lot of great efforts. We've had a significant surge, and we'll share some of those numbers here in a minute. But over the holidays, you know, Omicron has really taken root here in Genesee and Orleans County, like the rest of the counties around the region and the state and the country. And the amount of work and effort that's gone into, you know, try to track these cases and deal with the implications of those higher numbers, including the pressures on our healthcare system that Dan will talk about, are things that, have taken a lot of time. So again, I just want to give a shout out to my folks and thank them for the work that they continually do and have done during these unprecedented increases in spikes in cases and continued operations around testing and vaccination efforts. So with that, I'll move along to some data update. As I just mentioned, we have seen a very sharp increase in positivity rates and pure raw number of cases in COVID and spread in our community and in congregate settings in both Genesee and Orleans County over the last several weeks specifically. And we do know that this is being driven by the Omicron variant and a lot of post-holiday surge. Omicron has been isolated and verified to be in Genesee County. We received that notification a couple of weeks ago. It has not been identified by lab verification in Orleans County yet. But again, we do believe, and based on the number of spread and what we're having, that it is here, and it is the primary driver of these cases. As we go through some of this data, I just want to make sure everybody's aware. Our website, gohealthnewyork.org, is the primary site that we want folks to go to receive information locally from us. We have tabs on there for vaccination, where you can go on and sign up for vaccination clinics. We also have a tab on there for testing. If you click on that, you can report at-home tests. You can sign up for testing clinics. You can get information on testing, different locations. And then we also have a new tab on the New York State guidelines for isolation and quarantine that we'll talk about in a few minutes. But we try to make it fairly intuitive so folks can go on and get the information that they're looking for. It's kind of tab based, so you should be able to click and move forward throughout the website. But again, I believe the link is being posted there for individuals to be able to use that as they need. On a data standpoint, just some bigger raw numbers. Genesee County is currently at 12,105 total positives that have been identified, and we're at 164 total deaths. And again, that's tracked per the New York State Department of Health data. That's how we're reporting out deaths at this point. In Orleans County, we are at 7,654 total positives and 104 total deaths that have been tracked due to COVID since the start of the pandemic. As we dive deeper into this, we put out a report yesterday that had some additional data points, and you can see that there's a significant increase of activity over the last couple weeks, specifically into January. And again, this is primarily due to Omicron with the high infectious nature of that variant and just the amount of spread we can attribute to holiday gatherings, right? We did a lot of education pre-holidays about trying to do COVID smart, COVID safe gatherings. But as we know, people got together, and we did see a significant spike in the number of cases following Christmas, following New Year's, and the data is reflective of that significant spike. And again, we were not unique in this. This was seen again around the state. Just for a little reference point, Genesee County had 1,509 positive cases in December. And in January, the first 10 days of January, we have 2,118 recorded. In 10 days compared to the whole month of December. If we look at Orleans County, we had 938 cases identified in December, and through January 10th, again, we've had 1,125. So again, just from a reference point, you can see that things are very busy. There's a lot of activity going on in our community right now, which is one of the genesis has driven some of these changes that I'm going to talk about in isolation and quarantine procedures and case investigations and contact tracing. Just want to just remind everybody that again, COVID-19 breakthrough data is available. And if folks visit the New York State Department of Health website, again, with a lot of the changes that are occurring, our ability to capture a lot of the local data that we historically have been able to push out weekly or multi times during the week is changing. As we don't do the thorough case investigations and we're not into doing the contact tracing with this shift, we're going to lose our ability to capture some of these data points real time. And unfortunately, that's a bit of the trade-off. But we are going to be obviously still tracking the positives, tracking whatever data we can. But I just wanted to let folks know that is shifting. Most counties, including ourselves, are now going to be pointing towards the state data. Again, on the state website, and for people to be able to pull that data. It's not necessarily real time as well as we were keeping track of it. There's often significant corrections that are occurring over time, but that's really the best place to receive some of these specifically demographic data that folks may be looking for. And locally, we will be pushing out our data on Wednesdays on our social media accounts and our websites. So that's where people will be able to see anything that we're able to offer locally. We're going to have some charts and graphs with trend lines. So be able to, see the up and downs locally of what's going on with numbers. But again, this is really due with kind of the shift in approach. So we're responding to that with, again, adjusting what we're going to be reporting out. All right, so just bear with me for a little bit. I just want to take a couple minutes here to try to do a little clarification that give kind of some level setting on some of the terms that we're using here, just so there's a better understanding in the community. I've heard case investigations, contact tracing kind of conflated and interchanged with one another, especially with a lot of stuff in the news and just talking about this. So when we look at COVID, we've been doing this since day one. We do this with any type of virus or illness. When we talk about case investigations, this is when someone from the state or local health department calls a positive case. So these are people that actually have confirmed disease, right? They've tested positive. So we do an investigation from there. It typically involves looking at demographic questions, their name, address, different data points that we're asking about. We look at symptoms, we look at date of onset of symptoms. We look at a list of, we ask you about your close contacts, and, we try to identify the duration of exposure locations. We're really investigating that case, right? Trying to identify as much as we can about the person's history over the last 48 hours from when they tested positive or symptom onset, so that then we can, identify those contacts, right? So that's a case investigation. Contact tracing takes it a little bit further, right? So we identify the contacts in the case investigation of the positive case. And then what we're doing is, trying to identify those that were exposed. So when we talk about contact tracing, it's really identifying the exposed individuals, and then historically under COVID to this date, we were putting those folks under quarantine, right? So the isolation is the positives, the quarantines are those that are exposed to the positive. And, it really depends on the disease, but for the purpose of the COVID, obviously we've been looking at that within 6 feet of an infected person for a minimum of, for a total of at least 15 minutes, right? That is shown to be the case definition for exposure with COVID. So those folks will be identified, put on quarantine. So when we say that we're suspending contact tracing, and that's what the governor put out the other day across the state, that, they are now not mandating contact tracing any longer. It's going to be up to the locals and to what extent and how they want to do contact tracing based on capacity and availability. We're talking about the actual efforts of our staff or the state staff identifying those contacts when we do the case investigation, calling them up, putting them on formal quarantine. So that's really what's shifting. The case investigations, the positives needing to isolate, to stay home, to get their orders, that is not changing. Case investigations are still going to be occurring for positives. It's just that contact tracing piece is going to be flipping back over to the cases to identify their own contacts, to notify them, and then the contacts will put themselves on quarantine based on the new procedure. So with the new system rolled out by the state, every person that tests positive for COVID with a lab test, or if a reported home test through our website, again, if you take a home test and you don't report it, there's really no official way to track that you did it and that it was positive, et cetera. So we do have that home-based system set up on our website. Many counties have that. That does get uploaded and can be investigated like a regular lab-based positive test. So anybody with a lab test or home test through our system, the message will indicate from the state system that they've tested positive, that person should isolate for at least 5 days in line with the new guidance, that they should notify their close contacts, again, that I just talked about kind of in the case investigation process or the case tracing process, and then visit their local health department website to download and to receive their isolation and quarantine orders. Again, those are all up on the website now. You're able to do that. There's a self-attestation that you attest that you have a positive test, and these are the dates, these are your onset of symptom dates, and then you are able to print out your own order. After that 5-day period, again, you will then print out your release from isolation letter. If you're on quarantine, very similarly, you download your orders, you would attest that you were a close contact of a positive, and then after 5 days, you will then download your release from quarantine orders that you would then provide that letter. And depending on what your employer is looking for, they may want to see the order. and the release letter. They may just want the release letter. So you're going to have to talk with your employer or your school or whatever they are, depending on what they want in as far as documentation, to come back to work or to school. But those are all on the website. They're all able to be retrieved now, and that they are there moving forward for folks to use. All right. So just keep in mind, again, with this process, there's not going to be any follow-up from the county or the contact tracers at that point. We're asking people to self-isolate for that 5-day period. Again, notify your close contacts that they have been exposed, that you're positive, again, based on that definition. And they should quarantine for, again, that minimum of 5 days, and ideally get tested after that 5-day period just to confirm that they're negative before they, again, go back to work, go back out into public. But again, that's part of the process, and we'll talk about testing in a minute. Just so everybody's aware, the health department may still conduct case investigations and do a more thorough deep dive into certain areas, particularly congregate settings, which could include nursing homes, senior living centers, schools, et cetera, just due to the increase of potential spread risk and severity in certain populations. Again, we know that COVID, again, has a higher severity level in seniors and those with underlying health conditions. So we will be active and involved more so in some of these congregate settings than we are going to be in the general public. So again, the focus moving forward will be for those higher risk areas as far as our efforts into contact tracing. Just a little bit too with about to talk about this shift. Again, there's been a lot of discussion and questions on this. With the spike of COVID-19 cases throughout Genesee and Orleans County, as well as the state, contact tracing is not as effective in these situations. And this is one of the drivers behind why this shift is occurring now with unprecedented numbers we've talked about. It's virtually impossible for us to get to all of these contacts and to do this effectively. So you really need it. We're looking to triage and focus on those positive cases. Just for example, if 500 people test positive, which we had over the weekend in Genesee County over 2 days, each of those people typically we've seen historically so far have anywhere from 5 to 10 direct contacts, just based on household contacts if they went to an event into the community. That puts anywhere from 2,500 to 5,000 people that technically should be put on quarantine. As you can imagine, that number is virtually impossible to reach these folks, depending on even when we find out about the positive. So, when you look at that time period, contact tracing is just ineffective when you have that type of community spread. When you have 1 or 2 cases of tuberculosis, or you have a small clusters of measles, or even with COVID, what we've seen, when you have small numbers, it's very effective. You identify the positive, you put the handful, 10, 20 people on quarantine, and you can handle that. But when you get to these higher numbers, we obviously have to move away from it. Because of this, though, we are shifting our resources. It doesn't mean we're done working. We're not following this. We need folks to comply. Nothing is really shifted in the potential risk of exposure and the risk of secondary infection. These people that were formerly should have been put on quarantine by us formally, we're now asking to self-quarantine. There's still a probability that you may become positive, which is why we want you to take that test, especially if you become symptomatic. It's just that we're shifting the mandated push from us where we're going to be contacting people. With this shift, though, in responsibilities, the health department obviously is going to be able to refocus some of our efforts and move some capacity also over towards increased vaccinations, increased testing efforts, and continuing to provide education. So we obviously will still be working hard and making sure we're communicating and clearly trying to articulate what's going on in our communities, even with this shift away from the heavy burden of contact tracing. So real quick, just with isolation and quarantine, again, the new guidance came out last week. I'm not going to spend a lot of time on this, but just in general, the isolation has been reduced down to 5 days. If the individual is asymptomatic at the end of 5 days or their symptoms are resolving. Again, if someone is still very symptomatic, still not feeling great, they should still remain in isolation for up to that 10-day period, just like they would under the previous guidance. After that 5-day period, the other important thing is that people wear those masks, well-fitting masks out in public. The data and the reason for some of these shifts is based in what we're discovering with the spread of disease, particularly with Omicron, that most people are infectious up to 2 days before they become symptomatic. and 2 to 3 days after they become symptomatic. That does not mean that you're symptom free and you're not shedding the virus after 5 days, which is why we want folks to wear that mask. It is still possible that you still could be potentially infectious after that 5 days, but based on the, when we look at risk factors in the percentages, the majority of the spread is occurring again 2 days before, up to 2 to 3 days after, which is again why the CDC shortened that time period down to 5 days. So again, a little bit of responsibility in there, making sure, again, you're staying home. If you're sick, you continue to stay home for up to that 10-day period. And very importantly, wear that well-fitting mask 100% of the time when you're around folks if you leave at 5 days, just to be sure, to make sure we're knocking out any potential incidental exposures. Also, individuals who are moderately, severely immune compromised, the recommendation is for them to continue to still follow that 10-day isolation period, not the shortened 5-day window. And then those folks that are unable to wear that well-fitting mask after 5 days should, again, continue to follow that 10-day period. And again, just for the reason I mentioned, you still may be infectious. So if you can't wear a mask for medical reasons or whatever it may be, the guidance is to continue to stay in isolation for that 5-day period. Jumping over to quarantine, again, that has now been dropped down to 5 days from 10, similar to isolation. There were a few changes with this, that the state and the new state guidance. So if not fully vaccinated, or fully vaccinated and eligible for a booster, but not yet boosted, the state now is asking those folks to quarantine for 5 days and wear a well-fitting mask again for that additional 5 days. So the little bit of change here was the prior guidance. You did not have to have your booster shot to avoid quarantine. If you were fully vaccinated, you were able to avoid it. The new guidance is if you're eligible for that booster, so you got that shot more than 5 months ago, if you're Moderna or Pfizer, or 2 months ago, Johnson & Johnson, you are now being asked to quarantine for that 5-day period. If you're fully vaccinated and boosted when eligible, no quarantine necessary, but again, monitor for symptoms. Make sure you're getting that test if you start to become symptomatic, especially if, it's exposure based, and, you can proceed from there after that 5-day period. Jumping over to schools real quick, just as I mentioned every month, we continue to, and I actually myself meet with all of our school superintendents in both Genesee and Orleans County on a weekly basis. So we do talk about these different changes that are occurring. We did have some updated guidance come out last Tuesday from the state for schools. Obviously, I think there's been a lot in the news already about a letter that was sent out by the health commissioner earlier this week for schools with pending updated guidance coming. As of this conversation we're having, we have not received that updated guidance. We are not changing any approaches really in doing any type of modifications until we get that updated guidance and really see what's in there, so we can, again, have discussions with the schools to see how we're going to proceed with some of these recommendations and guidance. I will tell you that all of our superintendents and myself, we remain very committed to keeping our schools open, to keeping our kids in their classroom, and to continue with in-person learning. And again, we're trying to do this and balance, obviously, the health safety risk and making sure that our kids are in schools and learning in the setting that they should be. So we are working hard to make sure that's happening. We are getting, again, record number of absenteeisms with people out, teachers, staff out, and our schools are doing a great job with trying to balance and manage and keep things running. Which is why it's very important, again, that if we're symptomatic, we keep our kids home, we don't send them to school, and we get that test done. And if they are positive, keep them home for at least that five-day period. Additional guidance is also expected from the CDC for congregate care settings. We expect that to be coming out too. And again, that would include, our correctional facilities, shelters, child cares, nursing homes, residential, long-term care settings. So again, we're waiting on that guidance also. So when that does come out, obviously we will be, putting out information and sharing how that's going to impact us here in Genesee and Orleans County. All right. As we've talked about, I'm going to go over to the vaccine just a little bit and talk about where we are with our vaccine update. Again, COVID-19 vaccines are readily available. As we've talked about before, we have the full cadre of offerings here in Genesee and Orleans County, whether it's through the health department, whether it's through pharmacy. Some providers are vaccinating. We know that the vaccine is very important in preventing particularly severity of illness, including death. Our data has clearly shown, and maybe Dan will share some of this, but those folks that are fully vaccinated are faring much better than those that are unvaccinated. In addition, those that are boosted, most of the hospitalizations that we've seen are from folks that have not gotten their booster shot if they're eligible, and including those unfortunate passings and deaths that we have related to COVID. The strong majority of those are not vaccinated, and none that we've seen have been boosted at this point. So the importance of getting the vaccine is still there. As Shelley mentioned in the beginning, getting vaccinated and getting boosted are two of her points, I believe, that can really help us in this surge to get people protected and keep them safe from severity of disease. Both Genesee and Orleans County Health Departments are offering, again, our weekly vaccination clinics. We're vaccinating Wednesday in Genesee County and Thursday in Orleans County. We would encourage anybody to, again, go to our website. You're able to register for your appointments very easily there. And again, if you're looking for first dose, second dose, third dose, booster, whatever it may be, we can provide that for you. So hopefully it's fairly intuitive to sign up. If you have any questions, you can let us know. But ultimately, that is available for you, and we'd encourage you to take a look at it. In addition, folks can go to the State Department of Health website, and there's a vaccine locator tab, and you can go there and type in your address, and it'll show all the different locations within whatever mileage circumference you want to look at, what's available, and then you can go to that website and sign up via that method. As far as vaccinations, just real quick on the numbers, total population in New York State is about 78.9% with at least one dose and 70.5% with the completed vaccine series. And again, this is total population. Again, you can cut it by 18 and older or 5 and older, whatever you want to look at. But again, that's just in general. The New York State numbers, if we drill down and look at the Finger Lakes region, we're at 73.4% total population with at least one dose, 66.8% of the population. And I'm sorry, this is for ages 5 and older, not total population. 66.8% with the completed series, and 31.5% have received their booster shot of those of the population 5 and older. And again, that doesn't account for eligibility, because again, you got to meet those timeframes to be eligible. Jumping over to Genesee County, drilling down a little further, we're at 64.1% of the population with at least one dose, 58.9% with completed vaccine series, and 23.6% with that booster dose. Orleans County, 61.4% of the population with at least one dose, 55% with completed vaccine series, and 20.6% with their booster shot. So again, numbers are creeping up slow, definitely not where we want them to be. They are lower than the Finger Lakes as a whole, and obviously lower than New York State as a whole. As far as booster shots, again, we've talked about it a little bit, but we are strongly recommending people go get their boosters when they're eligible. It is showing clearly that that is providing an extra layer of protection, especially during this Omicron surge. Pfizer has boosters available for 12 and older. Once you're eligible and you're at least 5 months out from your previous shot. Again, Moderna, 5 months from your completed series, you're eligible for that booster shot. And J&J, again, is at 2 months. Homebound individuals, we've been getting a lot of calls still from homebound folks, whether they're looking for their initial shots or whether they're looking for the booster. We are taking those names from folks. So if you want to call up, we do have a list. And as our staffing is available, we are going out and vaccinating individuals that are having trouble getting out of their homes for that booster shot. If you can't wait for us to get out to you, again, we'll try to link you up with some resources where maybe you can get that shot sooner. But feel free to call us. We will get out there and we'll try to get you that shot as quickly as we can. It may take a little bit of time, obviously, with the shift in efforts here around from, obviously the contact tracing piece that may free up some additional capacity for us to get out into the homes and do some of this homebound work a little bit quicker for folks. All right, so let's jump over to testing. A couple things here. So testing is a lot going on this. Matt obviously shared a little bit about the efforts that's being done with the counties as far as giving out the test kits received from the state. I will comment quickly that Orleans also received test kits. We did get those out to the villages and the towns as distribution points, and they went fairly quick. Again, we did not receive as large of a number as we were expecting, unfortunately, of these OTC or take-home test kits. We do expect hopefully to get more of those. And again, Orleans will be pushing them out similar to Genesee through different distribution points, whether through the town or village offices, libraries, county office building. And the goal is to get those out to folks as quickly as we can. They are limited. There's not a lot of them available. So we're asking folks, when you do receive these, don't just take them immediately just because you got one. We really want people to hold on to these and use them when they need them. Maybe you're coming symptomatic and you want to check before you go to work or before you send your kids to school. Maybe you're going to go to a big party, a gathering, and an event, and you just want to be sure that you're not positive, even if you're asymptomatic. So you're not going to show up at that event and potentially spread COVID around. So, they are available, but again, they're very limited. So if you use it and it's gone, you may not have it for when you really may need it. So again, use them, keep them, and have them for when they're indicated for some type of an event or symptomatic testing, those type of things. We talked about the site in Albion a little bit. We had some press come out. This opened up a few weeks back. So we do have a state-sponsored testing site in Albion. It's at the GCC campus, which is at 456 West Avenue in Albion. Again, the GCC site center, probably most people recognize that as. They have registration and walk-ins acceptable that they accept. So, folks can walk in and get their test and or make their appointment. There is a web address for people to sign up, and this is being run by BioReference. This is the company the state has the contract with, so it's not being run by the state. It's not being run by us at the local health department. We don't really have any insight or say of what goes on there per se. We're just helping to promote it, encourage people to go there. They do have PCR testing, and those folks that have engaged in that process, I know it's been frustrating. The turnaround time is a little bit longer than they had indicated it would be. They were originally talking about 1 to 2 days. It's been taking 3 to 5 to 6 days, which is problematic. The state is aware of this, and obviously the company is aware of this. And, I think obviously they do these testing sites around the state. And due to the unprecedented cases we've had, unfortunately, there's a backlog in trying to run these tests, I guess, in a timely fashion as we'd like to see it. They have indicated that time frame is reducing and should be getting better, and hopefully more in line with that 1 to 2 day results. We need people to take advantage of this testing opportunity. We fought hard. Everybody knows we've talked about the inability to have rural testing, particularly throughout this entire pandemic. This is really one of the first opportunities we've had a state-sponsored free testing site for our residents. And it's not just Orleans, any Genesee, Monroe, Erie, anybody can come to these sites. So we really need to take advantage of it. We don't want it to disappear from lack of utilization because that potentially could happen. So the good news, what I'd like to report today is we did verify this morning that they are starting to offer rapid testing starting today. So they opened at 10, so you can go down there right now and get a rapid test for free. And they have those results uploaded to your portal when you engage with them. You get a online portal of how to get your results within an hour. So again, we'd like people to go down if you need rapid testing, go down there. They have it, and we're very pleased to see that they've added this new testing modality in, not just the PCR test, but also the rapid. And again, we're hoping to see the turnaround time increase quickly here on the PCR testing. We are continuing to test at the health department, very limited at the moment. We're testing in Genesee on Fridays and Orleans on Tuesdays, pending on what happens at the state site. Again, we're going to be referring most folks down there, especially for rapid testing. It's 6 days a week from 10 to 7. So Monday through Saturday, a lot of availability. If you're going to sign up for our testing, you can do that through, again, our website and receive your appointment that way. If you're coming to our place currently, we're only offering rapid tests. We do not have PCR at the moment. We'll notify folks if that changes. Just keep in mind that antigen testing is not often acceptable for travel or medical appointments, et cetera. You need to have that PCR level. So make sure you check ahead and verify that before you sign up and show up and find out the test we gave you is not sufficient, because that often doesn't make anybody happy. So. All right, so that's a bit on testing. Just on guidance again, real quick. Masking, New York State is still under a mask mandate until at least February 1st now, so a few more weeks, and we'll see at that point if the governor is going to be extending that for all public places. Currently, both Genesee and Orleans County are categorized as high level of community transmission per the CDC's definition. So both under substantial and high, which we are. The CDC recommends that anyone unvaccinated or vaccinated wear a well-fitting mask indoors and in crowded outdoor settings. So again, that is the recommendation by the CDC. And again, New York State does have that mandate in place. And again, we obviously, as we've talked about with the surge with Omicron, we want folks to, wear those masks as indicated. All right, so as I wrap up, I'm gonna turn this over to Dan here in a minute. Just always a reminder around our precautions. We're still in a pandemic. We're still trying to respond to high numbers of cases. Again, I believe we are moving towards that endemic model. Some of these changes that we've made here with reducing the time down, moving away from the heavy contact tracing component. Things are shifting in how we're responding to things and how we're going to move forward dealing with COVID. But as always, make sure, number one, you're staying home if you're symptomatic. We still can get a lot of feedback from folks when we talk to them. Oh, I just thought it was a cold. I just thought it was a sniffle. I just had a little bit of a cough. So I went to work. I sent my kids to school. And when they test positive, they're shocked. So we really want people to take advantage of testing. But first and foremost, stay home. Seek out that test. Again, here now in Albion, you can come get that rapid test and verify really quickly if you're positive. So that's the number one thing. Stay home. Same messaging we've always had for flu. Every year. And that's one of the biggest things we can do. Make sure you're washing your hands often, keeping that social distance as able, staying 6 feet away from others, avoid close contact with people, especially if they're sick in the home environment. Again, wear your mask indoors as indicated or in crowded public outdoor settings. Monitor your health daily. Stay home if you're experiencing any symptoms. And again, seek out that test and stay home and isolate for a minimum of that 5 days if able. I mentioned this the last couple months. I'm going to just take a quick second. It is flu season. We do have flu circulating. We've had more this year already than we had all of last year, just so everybody's up to date on the numbers. Through at least January 1st, Genesee County had 54 lab confirmed flu cases, and Orleans has had 17. You may recall last year it was virtually non-existent, at least from laboratory confirmed. So there is flu circulating, which has very similar symptoms to COVID, right? So again, the only way we're going to identify is through that testing process, but stay home, continue to practice those mitigation strategies. It's not too late to get your flu shot either. There's still those available in the community. So we would encourage people that have not done that to get their flu shot as we move forward. So that's the highlights of things. I know it was a lot. There's a lot to digest there. There may be additional questions. We're going to continue to try to make this as understandable and intuitive as possible as we move forward. And with all these changes, there's going to be some kinks. People are probably going to have some frustrations with accessing things and understanding what they should be doing. We're asking for patience and some understanding here as we work through this transitional phase over the next couple of weeks. Hopefully after we get through kind of the growing pains of this transition, things will smooth out and we'll kind of be in our new normal as we operate in this response to COVID. And again, hopefully we'll see those numbers continue to start come down from the Omicron surge and put us in better position as we move out of winter into spring. So with that, I'm going to turn it over to Dan to give the update on the healthcare side of things. So nice to have you here this morning, Dan, and it's all yours.
Great. Thank you, Paul. And a special thank you to Shelley and Matt for inviting me to join you all here today. And also, I want to extend a thank you to our media partners. We appreciate all that you're doing to get the accurate message out that Paul's sharing and that I'm hoping to share with you about the hospital status so that our community is most informed of what's actually happening and really helping to guide people to the best solution so we can work through this. Also want to extend a thank you to our own team members at Rochester Regional Health, our community emergency preparedness partners, including our local law enforcement, emergency preparedness, and fire and EMS agencies. It's hard to believe, but we're approaching that 2-year window in a few months. And over that 2 years, we've stacked hands, collectively worked together with one vision in mind, and that is to combat this ever-changing COVID virus, to keep community health and hospital services open and available to all of you and to the members of our community for many of us, our friends, neighbors, and loved ones. So a big thank you to all those folks that are working tirelessly out there to make sure that continues to happen. And they are every single day. I'll start with giving a brief update on what the hospital situation looks like today, and then I'll talk about a few changes over the last week here at the hospital to respond to some of the things that Paul covered related to the latest variant and how we're seeing the disease progress throughout the community. Overall today, capacity at the hospital is sitting at right about 86% over the last 7-day average. So that's been pretty consistent throughout December. And the end of December, we were in the 90% range, so it wavers up and down. But the last week or so, we've seen that settle back in about the mid 80s. And some key important things in our ICU as of yesterday's data. 100% of the patients admitted to the ICU were unvaccinated. And so that's kind of speaks to what Paul talked about, and certainly the trend that we're seeing. Also, 100% of the patients on ventilators are unvaccinated. And so the acuity is distinctly higher in those that are unvaccinated, and our data has been consistent on that throughout this latest surge. So you'll hear it over and over again from Paul, from myself, Shelley, and Matt. Please, please, please get your vaccine. It makes a difference, and we are able to show it in our data. Some other important numbers I think a lot of the areas tracking is about out of the total population admitted to the hospital, about 36% of them are COVID patients. So we still have about 64% of non-COVID patients in the hospital. And I point that out because I think it's really important to know, people are still seeking healthcare, and they should be, for what they need. And there is still patients who need healthcare outside of COVID. And so our job is to help strike that balance to make sure we have beds available both for the non-COVID patients who need periodic hospitalization, who need their chronic illness management, or have an acute event such as an accident or appendicitis or a broken bone. So services are open throughout our organization and throughout our community. We are balancing between the needs of the COVID virus response and the traditional healthcare that is needed. But I will tell you that about 70% of the patients that are admitted that have COVID, 70% of them are here for COVID. It is the symptoms related to COVID that have driven them here. There's another 30% that are here that tested positive for COVID, but we're here for other reasons. So that again is an emerging number that I think people are looking at so they can understand the impact of COVID. So that's what we're seeing in our hospital. And so again, and out of that number of admissions, 75% of the COVID admissions are unvaccinated people. So I think the data is clear. The science is out there. Unvaccinated folks are suffering from higher acuity. We are seeing them in our hospital, and as you can see, they're layering on over and above the traditional care management, which has made the hospitals throughout our region very busy. So let me speak to a couple of points. One, services remain open at our hospitals. We too, as many of our members of the hospital staff live in the community, do suffer from occasional bouts of COVID coming through our staff members, even though they're vaccinated. As we well know, even if you're vaccinated, you can get COVID, and you have to follow the guidelines that Paul talked about, and we follow those guidelines as well. If they're COVID, then they're out of work for the quarantine or isolation periods as needed. So periodically, you may hear us announce on our website or announce to the media that we might close a particular office or a particular outpatient area because of certain factors. Sometimes that is because of lack of staffing, and we just can't cover those spots. But overall, I do want to say that even though we may close one location, Our team has done an amazing job of accommodating them at other locations. That's been the beauty of both having a large footprint of multiple offices throughout the community, as well as being part of a regional health system where we can pull resources in to help cover and make sure that as many services stay open. But I always ask, stay tuned. We do have to respond to what we're seeing in the community throughout even our own healthcare community. So with that said, I'll speak quickly to elective surgeries. I think this is one as well. Back in December, we were above that 90% occupancy rate, as I mentioned. And so we were notified at that time by the Department of Health that we had to limit our elective surgeries. Surgery still occurs here at the hospital, just on a much more limited basis. If you need emergent surgery, you can get that surgery at our hospital. If there are criteria that you meet that allows you to go to surgery, and the state has given us those guidelines, you can get that surgery at our hospital. So surgery is not closed. It is just limiting it to limit the exposure of patients, as well as to manage the occupancy of patients in the hospital. The good news is, since that time in December, we have seen a progressive lowering of our occupancy. And while, as I reported earlier, we are below 90% for our last 7-day average, last week, New York State, based on the community prevalence of COVID and the continued rising numbers, did determine that the whole region was going to be on restricted elective surgery. So 40 hospitals in the region were notified on Thursday, and all have had to restrict to only essential surgeries per the guidelines. And so we'll continue to work hand in hand with New York State through that. We understand why that measure was taken. And as Paul's indicated, the numbers that we're seeing in the community concern all of us, because we want to make sure our services are open and available for all patients. So we have to take those necessary steps. Two other major steps that are going on here in response to what we're seeing is we did go into effect on January 11th, additional visitor restriction policies here. We had been able, since the last wave of COVID, been able to open up a little bit more visitation, but because the community prevalence continues to go up and we want to be sure we're protecting the patients that are in the hospital as well as our staff, we are restricting that. Visitation locally here at Batavia is from 9 a.m. to 1 p.m. and 3 p.m. to 7 p.m. daily. Each visitor that does come in has to be screened at the front door, has to be, their information has to be captured for contact tracing, unless they, in the event that they're exposed or turn out that they turn out to be positive and have to let us know. Couple areas. Visitors can still not see patients who are on precautions for COVID-19. So that has been something consistent throughout the COVID period, and that continues. We also do not have visitation for emergency department patients based on the space requirements and the unknowns that occur in that area. Cancer infusion center patients, also because of their decreased immunity, cannot have visitors. And then there are the exceptions, and these have been the traditional exceptions throughout. Pediatric patients can have visitation with parents, and parents can be with them. Labor and delivery patients can have partners and doulas available. Patients with intellectual and developmental disabilities, we're following the regulations related to providing support personnel with them, and cognitive impairment, including dementia in patients at the end of life. We have protocols for all of those, so we can help with that if you check in. So just be aware. I ask, if you have a loved one in the hospital, things have changed this week. If you come and the screener advises you of different regulations, it's because we've had to respond to this. We also are providing video visits for patients to their families when they can't be seen, such as with the COVID positive, and you can reach out to our screeners and to the patient, the staff on the units, and they will coordinate a video visit, so that we want to make sure loved ones still continue to talk to each other, even though they have to be in isolation at times. The other thing that you're seeing, and Paul commented as well, is the latest data coming out on the masks and the efficacy of the masks. And so we too are responding to that. We are shifting our mask utilizations We will not allow cloth masks in the hospital environment at all, or any of our other healthcare spaces. Staff who were potentially wearing cloth masks in the past have switched to medical masks, and then those with direct patient contact are switching to a tighter fitting. I think one example is the KN95s mask that allow a tighter fit around the face. So we're in the middle of that transition this week as well. We received a shipment of the KN95s through the health system, and we've been deploying them at the most high risk areas, but we have many more on order, and we'll continue to deploy them throughout that. If as a visitor you come and you have a cloth mask on, or you come for a doctor's appointment, you have a cloth mask on, our staff will provide you a medical mask to wear while you're wearing at that visit, and they can provide instructions on either swapping it out or wearing both if you choose to do that. So we will be asking anyone entering our buildings to wear those medical masks. So please, if you have questions, ask our team. Our team is willing to give you guidance, and definitely willing to guide all of us to stay safe as we go through this. Those are the major updates. As we said, volume stays fairly busy here. Our staff is doing a tremendous job, and we continue to manage through all the ever changes. The last thing I'll point out, maybe not COVID related, but it's going to get awful cold this weekend, and we always see some impacts of that, both by community members who maybe aren't responding to the cold as well, and they end up in our emergency department. So I just ask out to everyone, take care of each other, check on loved ones, make sure that you're prepared for Saturday, not just for the Bills game, but for the cold weather upon us. So go Bills, and thank you again for having me here, and thanks for everyone for your support. From our team to all of you, we appreciate the partnership and making sure that we keep our community safe. Happy to respond to any questions when you're ready for that. Thank you.
Great. Thanks a lot, Dan. At this point, if anyone has any questions, they could take themselves off mute, announce who they are, and you could fire away a question to any one of us. Yep, fire away, Howard.
Yeah, so we're hoping to be able to capture that. As I mentioned, if someone uploads it through our portal on the website, then we're going to be able to log that as a test, right? Just like it would be coming from a lab. The process would continue the same from there. Keep in mind, these do not go through Eclairs, the state report, the lab reporting system. These are home tests, but we're capturing the numbers that way. If you choose to do an OTC and do a home test and you don't upload that, no one's going to know about it, right? So it's only you taking that test at home. It's going to be harder to verify potentially for your employer if you're looking for COVID pay or anything like that. Those numbers are not being captured. I guess from the high level view, if you do that and you test positive, just stay home for your 5 days and follow the same protocol. But for the purposes of data tracking, we would need that uploaded to our site, and then we'll look at how we can report that out, Howard, to make sure we can try to differentiate between the two. Yeah, I mean, it's a great question. I mean, things are a lot different than they were a year ago at this time, right? We just started having the vaccine roll out a year ago. It was very limited. There wasn't enough vaccine available. I mean, we were focused on, Dan's healthcare workers and certain essential workers and employees. You fast forward a year, we have vaccines available for everybody down to the age of 5. We have booster shots available. We have, different recommendations on masking and how to protect yourself. We have antivirals and different therapeutics and things that we can do to treat people once they have COVID. So we're in a completely different phase of this pandemic as we move towards, again, more of an endemic model than we were. I think everybody has a certain level of risk based on your own medical, background, your own personal issues and medical history, that we're all different. So we all have different levels of severity and risk if we get COVID or any other virus. It's very important to protect yourself, and do the things that you need to do to take care of yourself. And again, wearing that mask is a barrier. Is it foolproof? No. Is it going to stop all transmission? No. Which is why some of that guidance out there has been changing to a well-fitting mask. And as Dan talked a little bit more about surgical or medical grade and KN95s and N95s, been a lot of talk about masks over the last 2 years. So we do know they're a barrier. They do help knock down some transmission, but again, the cloth masks, the buffs or the shirt pulled up, they're really not doing anything. So, again, it has to be done in line with the recommendations to try to reduce that risk. But, ultimately we want people to get back to their lives. People need to get back out and start socializing and engaging. And we have tools to do it safely. And following these recommendations and being, as COVID wise and educated as you can to make sure you're making decisions that first and foremost to protect you and your health concerns and needs, but also engaging in community and engaging with others. I think, again, our tools we have now can position us well to do that safely and effectively, especially if you are exposed and you do get sick, you spend that time at home to make sure you're not spreading it to others. And that's really the focus on the positives here and making sure they're kind of removed from the environment for up to that 5-day period. So we're really trying to lock it down at that level as best we can, but we need people to be responsible and have some self-awareness and some driven compliance here to make that happen. If people don't do that, because we're not monitoring like we were, we're not going to have the oversight that we've had historically. So we're going to be trusting people and encouraging them to, take this step to be honest and to take these steps on their own at this point. Yeah, well, we've maintained from day one. I mean, we can go backwards into, every time we talk, we say that this is what we know today, right? This is a novel virus. It's new. It's 2 years old now, but it's still relatively new. And we've learned a lot about it as we've gone along. And, I think sometimes, these changes seem like, why are they doing that? It makes no sense. And, a lot of them is driven by what we're seeing. And has it always been perfect and right? No. Have there been mistakes and shifts and changes? Yes. Are there probably going to be more? I would say yes. But we go by what, the data is showing and what we learn about COVID and the disease and the specific variants that are coming out. And they help inform the decisions that we make. This information that we're sharing today, these recommendations and ideas and ways to try to keep yourself safe, your loved ones safe, these are based on what we know today, the best way to try to do that. I think if anything, it shows that these changes are helping us to evolve and hopefully try to thread that needle, right, and walk that line of keeping people safe, giving recommendations, and not going the other direction of being onerous and just shutting things down and being so restrictive just because we're learning, we're becoming educated, and these decisions that as they come again are going to be done. Hopefully, again, looking at the science and the data and the idea of offering the freedoms and the decision, the self-choice that we want, while trying to keep people safe as best we can. Yeah, so that's still obviously that case is being heard by the Supreme Court right now. So I know Matt wants to speak a little bit to the timeline of some things, but we're still waiting to hear the final determination on if that's going to essentially be kept in place or if that's going to be kicked out. So we are waiting on that. But Matt, I don't know if you have the timelines, but my understanding is it's actually in place now. It's just not necessarily being enforced. Is that correct?
Yeah, so it's in place. I think the stay was lifted, and it is being listened. It is being heard right now in front of the Supreme Court, and so we are all anxiously waiting to see if this is something that's going to move forward or not. We here at Genesee County, because we do have a workforce of over 100, we are gathering the data, and we've collected the data to understand which employees are and aren't vaccinated, and whether or not, and watching carefully to see what the Supreme Court ultimately decides. Before we go forward and implement. And I think that's probably following suit with many other companies and local governments as well moving forward. But all eyes right now are on the Supreme Court to see what ultimately is decided. Yep, so we're sitting around 73%. I think is what it was our number of identified and confirmed vaccinated employees. And then from there, we will follow the guidelines come out. So this is an OSHA mandate, and so it is we follow in New York State PESH, and PESH typically follows suit with OSHA, but we will. It's a little bit of a further delay. So a 30 or 60-day delay after the OSHA mandate goes into effect. But here in Genesee County, we'll follow if the Supreme Court doesn't set aside, we will follow it, and there will be a testing requirement for all unvaccinated county employees. We're still working out the process because this has an impact of multiple bargaining units, and we're going to make sure that we make this as least intrusive as possible to go through this process. But that's something that HR and our compliance officer and our office are working through right now.
Hello, this is Jen Lukey from News 10 NBC. I have two questions, one for Daniel and then one for Paul. Daniel, were you guys doing some electives until that mandate was handed down by the state recently? And if so, sort of how does that impact? You were probably one of the only ones that wasn't at that 90% threshold. So have you had to cancel some things that you had set up?
Hi, Jen. Thanks for the question. Yeah, in December, we were maintaining the ability to stay open a little bit beyond some of the other hospitals in the area because our numbers stayed below. And so we were pretty much full open. And then it was that third week of December, the Thursday before Christmas, that we had received the order and we had to stop and reduce to just essential restricted electives. So we continue to do some of that fit the criteria because obviously there are people who need surgery, they need the procedures. And so from then on, we've been maintaining that course. This latest one, the only difference was we had seen our numbers drop below 90. So we were hoping to hear from the state we were going to be able to open back up. But that's when the state looked at the whole region and felt that it was better to be cautious and keep it restricted. So yes, beyond a few of our other partners and some of the other hospitals and regions, we did stay up a little longer in December. But since then, we've been on the restricted.
So since you have that capacity though, is like either your health system or the Surgeon Flex line sending you more COVID people, or are they sort of trying to flex to your facility because you have the space?
So we flex within health system pretty regularly. So we've been throughout the latest surge, since I think back till September, we've been working closely with other hospitals in the health system to take transfers to kind of maintain that capacity and help offload hospitals from other parts of the system. So we had done that for quite a while and continue to do that when possible. And we also reach out to other partners around. We work closely with Orleans Community Health and talking with the team over there. And if we can send patients to their facility, we do. And certainly we work between the other hospitals, even outside of our system as needed. So we do manage that load balancing across hospitals.
And thank you for that. And Paul, you mentioned this briefly. I did some stories yesterday about this letter that county health departments and school districts got about the changing guidance for quarantining student athletes and after school activities. A lot of the districts told me we're going to wait and see until the full guidelines are out, but they are hoping that there is some local flexibility there. Is that what you're hearing from your districts? Is that what you're hoping for?
Yeah, so good question. And we have also been receiving a lot of comments and questions on this. Yeah, so we as throughout this entire pandemic, we wanted local flexibility and some opportunity locally to weigh in on some of these guidance and just have based on what we're seeing locally in the need. So no different in this case. If you look at the January 3rd guidance on schools, it does say in there, unless your local health department has some different variations or is following some different protocols. So we're hoping when the updated guidance comes out, that type of language remains in there. That will give us the ability again to look at some of these different guidance and guidelines that comes out and make some determinations if that's really the best fit and approach we want to do for Genesee and Orleans. So we are going to be waiting for that updated guidance. I think again we're leaning more towards, again, if we're doing test to stay for kids that are exposed in quarantine. If we're testing these kids regularly, we'd like to see them to be able to participate in after school extracurricular activities. They're already testing negative for the day. So we know that they're safe to be in school. So the risk at that point would be no different from them being in school than participating in those extracurricular activities. So again, we're waiting for that updated guidance, but we are hopeful that we can have some flexibility locally, even if the recommendation is not to let them play without that booster shot when eligible.
Paul, it's Tom Rivers with the Orleans Hub.
Hey,
I
Tom.
wanted to ask you about the vaccination rates. You said it's lower than you'd like. Is there a target percentage that you're aiming for? I think you said Genesee is currently 64, Orleans 61. And I don't know if I could interject too, some of the people who were reluctant to get vaccinated, have you noticed an increase in them in the last month or two?
Well, so there isn't a magic number. Obviously, there's been different talks around where to get to herd immunity. And then obviously you have folks that now have had COVID, and specifically with the latest surge of Omicron, a lot of people have had COVID. So there's natural antibodies that come into play that obviously are effective, at preventing additional reinfections, et cetera. The state obviously put in place that 70% number last year. That was the target going into the summer, was get to 70%. If you look statewide, again, we are above that number now as a whole for the entire population. Our numbers are creeping up slowly. I would say that the majority of our newer folks getting vaccinated, it's mainly because of some type of mandate or some life need, right? They need it to travel. They need it to, go on a vacation. They need it for work. Any type of these mandates. So we're not seeing a lot of folks coming to get vaccinated now at the moment right now because they've, made a decision. Today's the day, basically. It's usually being driven by some other need or issue or a family member. We see a lot of folks make determinations to move forward with something if a family member dies or has a severe case of COVID, so that we call those cues to action. When those happen, that generates people to respond and say, well, this person I knew, this loved one, just had a very serious case of COVID or unfortunately may have passed, and I don't want that to happen to me. Or pressure from family, hey, go get your shot because I don't want that to happen to you. So I think there's some of that going on now. And so we're really trying to talk to those folks that are still undecided and still thinking about whether they should get vaccinated, whether the vaccine's safe, those type of questions that folks still have. And we always refer folks to their primary care provider, their medical provider, if they have any questions, again, based on their unique medical history or any questions they may have if the vaccine's right for them. But ultimately, we're seeing, again, based on the data we shared and what Dan shared about hospitalizations and ICU and vents, that the vaccine is very effective. It does keep people from having severity of disease and keeps them off the ventilators, keeps them out of the ICUs, especially the booster shot now. So we'd like to see higher numbers. They are creeping up, but we are lower than the Finger Lakes average and we are lower than the state average. So we do have some room to grow there. And again, we're just hoping that with the messaging, with the information we're providing and continuing to just push that out there, that these folks will make that decision at some point in the near future.
So Matt, I'm not hearing any more questions. I think that there has been an extremely thorough job done in explaining all of the new guidance. And if you have further questions, our websites are available for the County Health Department, and also Dan Ireland, thank you for joining us with your hospital capacity information and what is still available in our community. We really are very, very fortunate to have the leadership that we do have in Genesee and Orleans counties for our health department, and especially the staff, which has not given up on us yet. And dear Lord, we certainly do appreciate them and their every waking moment that they spend taking care of everyone here in Genesee County. Thank you to our media partners, and I'll sign off.
Thank you, everyone.